I want to welcome everyone to the webinar today. We're going to be talking about basic income and belonging, which is a very specific take that we at Miracle Messages have on the importance of social support as well as addressing people's concrete needs. And I just want to say, I so appreciate everyone making the time to be in conversation with us today. It's a hard time, a busy time in the world, in our personal lives, and in our work lives as well. And, there's just a lot going on, a lot of challenges that folks are facing, certainly across sectors that support people experiencing homelessness and definitely in the homelessness service space. And so just really grateful that you've made time and don't take that for granted. And I'm also grateful to be in community because it's something that all of us need, right? This sense of connection and just to be together and to feel that we're not in it alone. Um, and for us at Miracle Messages, that's our focus. We want to make sure that no one is experiencing homelessness alone, and that no one feels helpless when it comes to addressing the issue of homelessness. And so we need one another in order to do that. And we do this through a couple of key programs. We'll be talking a bit about Miracle Money today, which is our financial support program. It includes basic income as well as some other financial supports. And that is with the specific focus, again, with our mission to make sure that people have the space and the time needed to create those relationships and foster relationships in their lives. And we also have reunion services. This is the first program ever at our organization, and it helps unhoused neighbors connect and reconnect with their loved ones. And Miracle Friends, which we'll also touch on briefly today, which is our phone buddy program where unhoused neighbors are matched with volunteers and they talk on the phone or text weekly and just provide a sense of connection and their listening ears to whatever is going on in life that day or that week. And so that's a little bit about who we are and the lens that we bring to the webinar today as we talk about basic income and belonging. I want to take some time to introduce our amazing panel. I'm just so grateful every time I get to be in conversation with Sarah, Estara, and Nellie, and then I get to be in conversation with all of them at once. And I'm so just really excited. Sarah Berger Gonzalez is an expert when it comes to the social safety net and also has overseen internationally a variety of cash transfers. She's authored legislation and also guided administrative regulatory changes that affect or touch basic income and cash transfers. And she's also helped to guide over $1 billion worth of efforts in poverty alleviation across multiple countries and continents. So brings a lot of experience in program design, research, policy. Stara Pearson, who is Vice President of our Miracle Messages Advisory Council and also an accomplished author and, artist, the other A word, artist and poet. You may have authored things too. And a committed volunteer in her community. Astara brings just a deep commitment to making sure that there is access to community healing and helps people get connected to our programs and also does this by sharing openly and candidly from insights that come from lived experience. So thank you, Astara. And we also have Nellie Stasny, who is the director of our Miracle Money program. Nellie has done it all when it comes to the last couple of years here at Miracle Messages, from direct street outreach and support across our programs, and certainly has had the vantage point of seeing multiple iterations of our basic income work. And so she'll be able to share from that lens today. And I'm Sheena McKinley. I'm your moderator for the day, and just super excited to delve into this conversation. And then last but not least, we have Megan Newcomb. She's project manager with our team and will be helping if you have any, tech issues in the chat. And also certainly feel free to engage, share your own insights, drop links in the chat, ask questions. We ask that you add them directly into the chat, and then Megan will compile them, and then we'll hold till the end of the panel conversation to do the Q&A. And not to worry, we have a good amount of time for Q&A, so we will be able to get to all of that. And so with that, yeah, I would love to just kick off with a few other other just grounding pieces. And so you may have noticed when we registered for the event today, we asked sort of what your background or familiarity with basic income was, and we got a really great range of things. And, I'll say this, even if you read about basic income every day for the last, few years, it's hard to make heads or tails of things. Even just from this one slide, you see some of the headlines that come out across different newspapers or different reports, sometimes within the same, publication or newspaper, you'll see different takes on basic income. And so it's hard to look at a single article or a single webinar and say, okay, now I understand exactly how basic income works for all of the things, right? And, I think the purpose of today's call is really just to get grounded in some of the knowledge that we have about basic income and what there is left to explore, and really to just be curious, to have questions and to learn from one another and to be open to that learning as it emerges. And then the other thing that's really helpful for the conversation today is just some familiarity with terms. This is not, it's not a test, it's not a quiz. It's just to help get familiar with some terms that often come up in conversation. And, oftentimes, even when you know the difference, you'll kind of like toggle back and forth between terms. So it's just to help get familiarity as we, maybe drop some of these terms in the conversation today. But no worries, get familiar. You won't have to take a quiz. And so basic income is at its heart unconditional and regular payments, right? And it is a defined amount. The amount can kind of vary across distributions, and it is distributed regardless of income or employment status. Guaranteed income is something that is a little bit more targeted. So oftentimes you'll see it specifically for low or moderate income individuals. And so there's a targeted component to GI or guaranteed income. Direct cash is just a broader way of saying there is a one-time or time-limited source of payments, and they go directly to the person that will be deciding what to do with it. And then cash plus, you'll hear certainly, about halfway or towards the middle of the call today. And that is this idea that cash does something very important, but that it is powerful when it is combined with other things, other resources, other services. And so cash is the plus. Cash is not the only, right? And that is something you'll hear today in the call around the cash plus model. All right. And I think with that, we can get started. Let me see. Actually, before we get started with the first question, it'd be great to just get a pulse check of how people are feeling in the room. So we've got this poll. Just take a minute or two. You should be able to read the statement and just let us know what you're feeling, right? Basic income is effective for helping people out of poverty. How do we feel about this? All right. See the real time answers. And it's great just to have the candor in the room of how we're feeling. And again, this is a safe space for conversation and questions. So we really welcome all of the different perspectives. Okay, let's go ahead and share the results so that we can see what we're feeling in the room today. And we'll see where it lands for us as the call continues. All right. So I'm going to dive into the dialogue and the conversation today. And I'd love to start with you, Sarah. As mentioned when I was introducing you, you've overseen lots of different versions of cash distribution and cash transfers. Um, I'm curious if you could share two or three really concrete things about what we know in terms of how do cash transfers work? Is there any evidence that they work, and how it should work?
Yeah, thanks, Sheena, and thanks, Miracle Messages, for having me. Such an honor to be with such an amazing organization. So internationally, cash transfers have actually been implemented for decades, and more recently, we're on our third wave of cash transfer pilots in the United States. Cash transfers is quite frankly, I think one of the most rigorously evaluated interventions with more than 1.4 million papers written on the intervention. And still, there are a lot of research questions out there because, as you mentioned, right, these pilots and cash transfers, they tend to differ in terms of vary in size, duration, population, purpose. So with certainty, we know that regular cash transfers, consistent monthly cash transfers, smooths income consumption. And we see this today, right? Escalating expenses, inadequate wages, shaky safety net, week to week fluctuations in income. It made daily living in the US a really big challenge for individuals, families, and households, even among those working. And so we know that cash transfers supports individuals and families in meeting their nutritional needs, keeping the lights on, so paying for utilities, helping to pay rent, and reducing the cost of childcare. Or better summed up, I would say that cash transfers provide some level of financial stability, relieving the hidden burdens and stress that individuals and families hold from absent public benefits or market failures and return really to them agency to best meet their needs.
Yeah, it's so powerful to hear that, Sarah. And again, I'm just sitting in this space of like, it's nothing new, and yet it is so new, right? And we're really like learning so much from that space. Nellie, as I hear Sarah talking about relieving the stress, relieving that burden, I'm curious from your lens, what led Miracle Messages to even get into the space of basic income, and especially as an organization that has this very specific space within homelessness supports and services to address relational poverty.
Yeah, I think it really ties into when Sarah talks about like agency and choice and how flexible cash is. But I'll kind of take people briefly through the journey of Miracle Messages and how we got to where we are today. And then we'll talk much more about like where we are today and where we see ourselves going in the future. But so for us, distributing cash the first time really came from like listening to our community. So when Miracle Messages started nearly 10 years ago, Sheena, as you mentioned earlier, like we started by reconnecting people experiencing homelessness with their housed loved ones. And as that work evolved, we continue to hear that for some people, reunions where rebuilding those past relationships, they weren't the need. But in some cases, there was a desire to build new connections and new friendships. So then that brought us to during the pandemic when the shelter in place, the SIP hotels were popping up, specifically all over San Francisco, which is where we were focused at that time. That's when we developed our Miracle Friends program. And so that program is the phone buddy program, weekly phone calls and texts with a friend. I often call it like a digital pen pal. But so as that program grew, we heard from our Miracle Friends about specific needs that really only the flexibility of cash could solve. And so when you have these recurring relationships with people, you become close to them. It doesn't feel like solving a problem, it feels like serving community. And so we knew that the flexibility of cash could solve this. At that time, we fundraised $50,000 and we distributed it through our proof of concept pilot. And so, yeah, we see cash as not only a way to meet basic needs that Sarah talks about, but also as a tool for people to invest in their relationships.
Thanks for sharing that. I'm wondering, Astara, you've encountered basic income in different ways, and the programs around social support also in different ways. And so I'm curious how your understanding of basic income has shifted across your own experiences.
Yeah, yeah. I didn't really know what to think about basic income like when I was first introduced to it. But it was definitely a lifeline. Like at first there were um needs that I needed to meet while I was in the shelter that I wasn't able to with I was getting I think like $100 a month. So for example, like going through the free phones that are offered, they're very easy to go through quickly. So it allowed me to meet needs where I was able to get things that could help provide for me longer term. And then as I continued with miracle messages and with this with the basic income, I started to realize that the needs that I was able to meet were like beyond just the surface level of like things to get. It was the start of like that deep healing process that I needed to have from that whole experience.
Hearing Astara's share, just a glimpse into some of those experiences, Nellie, I wanted to kind of come back to something you mentioned, which was, the evolution from pilot to sort of a California-wide distribution that was linked to an RCT and mixed methods evaluation, and then now to the current version where there's one fund distributed directly with Miracle Messages in our community, and then another fund that leverages strategic partnerships with five other organizations. So could you walk us through sort of like what led to from one learning or set of insights into the next version and the next version? Because there's clearly a thought process in that evolution.
Yeah, I think too that like Astara's point of view gives such a good zoomed in view of like you hear that and you're like, oh, we got to do this again, right? Like we have to do this more, we have to do this again, we have to do this better. And so we did our proof of concept in 2021, and our proof of concept was $500 a month for 6 months to 14 people in our Miracle Friends program. I don't know if everybody else like likes the numbers of the program. I'm heavily biased, but I love the numbers of the program. So you'll hear me like talking about that and the dollar amounts and the program sizes. But so all of those folks were unstably housed or experiencing homelessness. And then the second iteration, the next phase, because the proof of concept showed promising results, that led us to the RCT. And the RCT, our randomized control trial, was with the University of Southern California's School of Social Work, where during the distribution, people were placed into one of three buckets. So they were randomized into one of three positions. One of those was the waitlist. One of those folks received a Miracle Friend. They joined our Miracle Friends program. They had a Miracle Friend and also $750 a month for 1 year. And that's through Miracle Money. We'll hear miracle a lot, so I'll try to differentiate what exactly what miracle I'm referring to. But so one of the key programmatic takeaways that we learned during the RCT was really about partnerships. And so in this next phase of where we are now, we have two different distributions. So our Thriving Community Funds distribution, this partners with 5 homeless service providers throughout California. It distributes $750 to 110 individuals. So it kind of mirrors the RCT portion, but it's so closely tied with these 5 partners throughout California. Our other distribution, Dignity Funds, is Friends, but both of these programs are really focused on the cash plus. So the main focus is on the services being provided, and that the cash is a tool to amplify the impact of the services. But I think it's helpful to frame what some of our measurement domains are going into these next iterations. And so Three of our measurements are basic needs fulfillment, connectivity and relationships, and then self-perception of well-being. So we're in the middle of our evaluation for these programs now, but we're already hearing from our partners about how cash has been shifting the relationships between clients and staff, and how the cash is allowing people to come up for a breath of air, kind of what Astar has already mentioned, but to look at goal setting rather than survival. And we're also seeing that cash is giving people the power of choice.
Thanks for sharing that, Nellie. I'm sure we can delve into lots of details on each of those things in the Q&A. And, you started to really frame up the Cash Plus, right? The Cash Plus for us, layered with the Phone Buddy program, other social support programs, Cash Plus for our partners, the 5 agencies across the state of California who work with people experiencing homelessness and housing instability and offer a wide range of services. And so it's layered onto those services. And so I want to kind of dig into that Cash Plus a little bit more and come back to you, Sarah. Why Cash Plus? What does it do that versus cash alone? And we started to touch on that, but I'd love to get your lens from all of the Cash Plus models you've seen.
Yeah, so oftentimes when I talk about cash transfers and we think about cash transfers, and again, like we have all this evidence, and still questions to be answered. I often think about cash as a tool. And if we think about like if we're building a house, a hammer serves one purpose, a Phillips screwdriver serves another purpose, a flathead screws. So we need all these different tools, and cash is just one of those tools in the wider toolbox. In 2000, after the 2008 financial crisis, global financial crisis, there was a recognition internationally. Cash transfers are really critical for meeting basic needs and smoothing consumption, as we talked about earlier. And it was not really enough to move people out of poverty and to address all these multidimensional elements of poverty. I think in the cash transfer context, we often talk about because cash is addressing financial poverty or material poverty. We also need to talk about relational poverty, and that's a real, true thing that folks experience loneliness, anxiety. And so over the last 15 years or so in the international space, cash transfers have continued to be an important tool in response to crisis. And there's been an increasing recognition that it needs to be paired with other types of supports or services alongside that to meet outcomes of interest, whether it be housing or productivity, employment related, mental health services. So again, recognizing, almost as Nellie was mentioning, that cash is almost amplifying their ability to access services. And so I think as we see in this space, in the US, I think it's starting to be looked at in different contexts. We see emerging research and practical applications are starting to demonstrate the potential of integrating both the direct financial support alongside supportive relationships to meet those needs and really catalyze in a lot of ways those improvements in health and well-being alongside traditional homelessness response systems or systems in general. And we see this to be true. A lot of this we could really even pull from the research in the health space, where we see that in communities across the country, this already exists. There are well-trained volunteers or community health workers that are accompanying folks who feel socially isolated or socially isolated to reduce anxiety, depression, and those feelings of burden. And so again, in the US, with folks who are experiencing homelessness, qualitative evidence is starting to emerge that when you pair cash with tailored supports and that supportive relationship, it begins to really amplify that those results around housing, that longer term stability, and in a lot of ways reignites a trust that has long been broken with either human to human or human to service provider.
Yeah, thank you for sharing that, Sarah. I'm thinking I really want to delve into this issue of reestablishing trust and also this notion that we need to think about the cash as a tool in a toolbox of other tools. And so oftentimes I think understandably, it could be tempting to just look at cash distributions and say, oh, okay, what was purchased? And did you save up for first and last month's rent? And, um, like someone could write, I don't know, a budget on a piece of paper and say, like, this is how you would do it across 12 months. And then, like, at the end, you will have first and last month's rent, right? But I think it's also like the relationship with yourself and that healing and, what that is doing alongside accompaniment with others and a listening ear and that trust being rebuilt and a constellation of other services. And so when I think about that, Astar, I know we've had a couple conversations. I think about broadening our understanding of the impact of cash and a cash plus framing. And so I wonder if you could share a little bit of what that impact has looked like for you.
Yeah, absolutely. Like Sarah had mentioned, with sorry, hold on. I'm very nervous. It having that the like unconditional aspect of it was super important because not only did it give me a lot of flexibility within my own healing process that I was doing internally, right? Like I had the ability to really make adjustments based on my needs in that moment, which was super important. That helped me build my confidence. But it also gave me the autonomy to like take actions to help myself in ways that I was like relying on service providers for different things. Like I was able to say, oh, I need to go get a driver's license. I can just do that. Like I don't have to wait, however many months for that whole process and the voucher and everything. I was able Oh wait, no, actually I already mentioned that. Yeah, it went a lot deeper and started to have an impact on just how I viewed myself and my capability, like within the world. And those lessons have continued, not lessons, those blessings that have come from this gift have continued to blossom even, years after the fact. It's been a couple of years now, but I really needed to be able to see myself in such a capable light. And because I was so restricted financially during that time, I didn't realize the potential that I had to help myself and then in turn go out and help other people.
That's really powerful. Thank you for sharing that, Astar. And, what I'm hearing is, yes, obviously, the cash helped you have some of the flexibility to go get a driver's license, right? There's these concrete things happening that are all super important to life and to livelihood. And yet there is this deeper, impact it's also having, right? Due to the flexibility, due to the agency, and due to just sort of like a reclamation of dignity, right? And so, Nellie, I'm really curious, you've been hearing from participants across this year's iteration, across all the iterations. But I think you've been sitting in people's stories as well, where there's just like so many nuances and a multifacetedness to the impact of a cash plus model. So I wonder if you could share a little bit about how that is impacting both basic needs and relational supports and a sense of connection.
Yeah, I think what a star shares too, you see this deeper aspect of like the cash is impacting almost like how you're moving through the world. And that is so much more. But so one way that we're gathering these insights this year is we're trying something new. And so we're doing something we were calling digital diaries. And so we're inviting people, we're testing it small and seeing how it can work best, but we're inviting our cash recipients or participants to share photos or like testimonies of ways that the money has impacted them or in any way that they really feel called to share. And so I feel very lucky because I get those I get those pictures first and it's like really sharing these, like being of witness to these beautiful moments. And an interesting common theme that we see is a lot of people sharing meals together. And so I think this example of people sharing meals, or spending time with children. It is so many people, when we say share a moment of impact, we hear things about being able to pay bills and the relief that that causes, but the things that almost feel like hold the greater weight is like the quality time that they're able to spend with people. And so I think of this one woman who's in our programs who she sent me a picture of her and her friend at a pupuseria, right? They went out to lunch. And I'm like, yes, great choice. Thumbs up. And she's sharing how she's taking one of her friends who's staying at the same shelter with her out to lunch. And I think at the surface that we can say, "Oh, how beautiful." Thumbs up to like direct cash. But when we take a moment to look at that deeper, we see this moment actually in those three domains that I mentioned. So we see that our basic needs are being fulfilled through the fact that you are getting a meal that day, you are nourishing your body. You will see the relationships and connectivity obviously being invested in through spending time with a friend in a quiet place where you're able to sit and focus on each other. And then we can ask, how does doing that act impact the perceptions of well-being? How does that impact how does it feel when you are able to take a friend out and provide something not only for yourself but people you care about? Um, so these stories, I think, are more than beautiful. It's actually these moments of impact that we're seeing happen.
Thanks for sharing that, Nellie. And I think the example of the digital diaries and some of the other the future work coming up in this program is a way to center lived experience and the insights of people who are most expert in this work, which is because you know how it's impacting your life and you know what you're navigating. And so, like, whether that is through advisory council that Star is on, and also the participants in the program as they share and underscore what the themes are in their own stories, right, via those diaries. I think that's such a critical part of making basic income work for the people who are most impacted. And so I think with that, I want to pause for just a second to launch our second poll. And as folks take a minute to answer, we just kind of want to let some of the stories and insights that have been shared sink in a bit. And so this is, again, quick, just sort of what's your gut reaction. Relational supports should be a core part of basic income programs for people experiencing homelessness. And we'll see where things shake out. And this is actually a really interesting emerging question in this space because I think while conversationally people might say, oh, makes sense. Like people need to be in community, people need connection, or people need relationships to have what Sarah was talking about, accompaniment and like social support as a must have, as much as addressing essential needs is a must-have, come together is really kind of an emerging space to look at in a basic income work. All right, so let's go ahead and look at the results. Wow, we have a very supportive audience. But and also I just want to say, like, it is healthy to be unsure because again, like, one conversation is not going to answer all of the questions, but I think the more we sink in to reflection and learning and curiosity, there will be more space to explore together.
One thing I just wanted to add on really quickly, something that, I think what Nellie and Astar are really describing too is this this sense of belonging, this sense of community and belonging. And I think there's a lot going on. And when folks are seen, and they are almost re-invited back into a community that maybe at one point they didn't feel like they belong. And so that invitation, that connection, those connectivity and relationships, and so the cash in a lot of ways is, again, it's that tool, but it's like a spark, just an entry point, to re-inviting folks back to the table where all can sit and break bread together. And it's Nellie, thank you for sharing those stories. And Astara, thank you for sharing your own story. Because I think that that power of community is so real.
Yeah, I love that. Thank you for sharing that, bringing that all together, Sarah. And it's like, this feeling of like I can come back to this communal table, and also I can now feel empowered to create more and other communal tables for others, right? Like I've seen, in the stories that Nellie was sharing, people are, um, you know, gaining that strength for themselves and also creating spaces to strengthen others, to take others out and see that they could use that meal together. I know that is like so much of what our advisory council work does as well. And Star, I know that you highlight that as well. Um, I wonder, I'd love to hear from each of you something very of this moment, right? Which is, why does the work of Cash Plus, right? Why does basic income and social support matter in this moment in time, with so much urgency, so much increasing need, but also a lot of competing priorities, right? Like, I feel like any of us who have been in social services or just like lived life know that there's always these competing priorities and it feels harder and like more impossible choices right now. So why does it matter to prioritize this right now? And what's left to explore, right, in the coming months and years? And maybe we can go with Astara first.
Okay, so sorry about that. Um, I definitely think that the power of compassionate acts, and unconditional love is so integral to creating a future where there is a deep sense of community, for everybody, and everyone has the opportunity to build the life that they want and to love people freely without restrictions. And right now is when we are creating that future. And I mean, yeah, yeah, I think that it's really important to love people like that. And now is a time when we need it.
I feel that. Thank you, Astara. Nellie, why now, right? Why keep on keeping on and even growing it?
Yeah. I was really when Sarah mentioned at the top that there was like 1.4 million articles or evaluations, I can't remember the exact words, about basic income. Direct cash is not new, well, clearly, but it's becoming increasingly popular that it feels new to so many people. And so really the Cash Plus is meant to be focused on the services and the cash is to amplify the services, but I really think with direct cash there's so much space to go deeper to look at different outcome areas. It's incredibly common, and also note that today we really are talking about the intersection of like direct cash and homelessness. And in the direct cash space, it's much more than just homelessness, but of course, as our organization, that's our personal lens. But of course, housing outcomes and housing status is like a key metric and indicator for any homeless service provider. And although Miracle Messages, we are not a typical homeless service provider in that sense because housing is not our focus and it's not our lane. We really do focus on relationships. Um, but I would really encourage the space to move more than to look at housing as the main outcome metric. We hear it from our friends that oftentimes this cash it's used to fill gaps. It's used as a bridge. And so when you look at the numbers at the data without talking to people, without knowing their name, it looks like they finished where they started. But it's not true. Life goes on, these like trials and tribulations that people go through, and the cash helps keep people afloat. And so I would just encourage the space to like find those stories, learn from those stories, and ask how can we capture those parts of the impact? And then, of course, like, I'm biased, but to really look at the lens of like relationships and belonging and how cash impacts that. And we're working towards those measurements too, but the movement is more than just us, of course.
Yeah, and that's a great segue to coming to you, Sarah, right? Like you get perspectives on lots of different programs that are in different seasons or stages. What makes it, still a priority for organizations? Why should people double down kind of on it? And what is there left to explore?
Yeah, I mean, so all great questions, especially as I mean the day-to-day stress of putting food on the table is very real. So I think two things that come to mind. One is just this last month, we're still in the current month. 42 million Americans lost their SNAP benefits. And I want to just lift up an example of the power of public-private partnership, which I think we're going to continue to see in the cash transfer space. The city of San Francisco was able to leverage public funding and get a match from private dollars to allow for SNAP benefits to be issued to 18 million folks across the city of San Francisco, County of San Francisco. And so for me, like when we think about cash transfers and that power, that was a one time and it brought together folks in the community to say, we will not stand for food insecurity and we want people to be able to provide for themselves, and still it was a cash transfer to them, and so again allowing for that flexibility so that folks could sit around the table and still meet their nutritional needs, I think is one way. So I think we're going to see, I hope that we continue to see more public-private partnerships in this work. The other example that comes to mind is a couple of years back, from a big P policy level at the federal level, there was a deep recognition that housing needs to be an important part of healthcare. Housing has to be an important part of healthcare because when we think holistically about an individual or a family or a household, housing is a part of that. It's not just a pill to address the symptom. It's not just addressing one thing over here and not seeing the other thing over here. And so when we see that holistically and that bringing together across services and systems, that's truly where I see some really powerful things happening. Because again, cash can be the entry point to that, or it might allow access or engagement to be easier. And the folks in those systems have to be willing to come together to meet the individual or the family, not the individual going to all these different places. So those are kind of two areas where I see potential and why we still have questions to answer around this and the power of this tool.
What's so powerful about everything that you all are bringing up is like we need everybody for this, right? Whatever your role in the community is, whatever power you have, and we all have some power, right? Is like we can all contribute to figuring out how to partner together, how to roll out, essential resources, right, in a nimble and immediate way, and to be part of also that learning together and that evaluation, right? And I'm not just talking about like, I'm a researcher, but it's about every participant being part of the evaluation, program managers, case managers sharing their feedback and their insights, and like making sure that program design and refinement and quality takes that into account, that there's accountability for every story that's shared and every insight that is shared. I wonder if each of you could kind of delve into what's the future with a concrete piece of advice or recommendation. We have a lot of different perspectives joining us on the call today, probably a lot of different perspectives watching the recording afterwards. Hello to you in the future. And just people who come from program where maybe they're part of basic income or social support work and they just want to do more, go deeper. Others who might not be part of it, but might just be considering it, like, oh, I've been wanting to do that, or where our organization is starting to discuss that, from folks from policy side and research side, whether that's applied research or from academic institutions. A lot of folks with lived experience and just that expertise also joining us today, donors and funders and just supporters and champions and allies. So I'd love to kind of do round robin again and hear one or two pieces of just like, this is what y'all should do, right? This is a recommendation, a suggestion, or a piece of guidance that you would offer. And so we'll start with you, Star.
Yeah. In my small and humble perspective, on the other side of things, I would say if you're considering, designing something like this or, expanding, be open to the possibility that people are inherently good and that they want the best for themselves and that they're capable of choosing that. Like, don't be afraid to ask them and to to let their opinions hold weight. Yeah, that's my little 2 cents.
Yeah. And we'll come to you, Nellie. What are your concrete kind of pieces of advice or recommendations?
Yeah, really speaking to people that are involved in either leading or supporting programs, whether that's on the actual program side or the research side, but I would really encourage people to intentionally structure your budgets and your time and resources to hear from people experiencing your program and have that be a main goal. Um, yeah, I know Sarah has so much experience in doing that, and I know a lot of programs do as well, but I think it's such a pillar that isn't as talked about as it should be.
Love that. And it's great for end of year look forecasting to next year's budgets. Sarah, I'm going to come to you. What's a piece of advice or recommendation you would offer up?
I mean, we could probably talk, we could have do a 4-day workshop on, the right payment provider or benefits protections, or design, other design features. I think kind of piggybacking off of what both Astara and Nelly shared is last week I was in a focus group, and a young adult shared with me, someone that something that they wish they would have told them earlier as part of this work, and it was just that you matter, hearing that you matter. And so I think the design recommendation or the recommendation of the thing is just to slow down, when possible. I know there's this speed of sometimes designing these programs and getting off the ground and getting cash in the hands of folks is the focus, but slowing down and just, I think, centering humanity in the process is so important.
Great. I'm really curious, what is giving people hope kind of in this moment. I know that there's like a lot to figure out, a lot that's super challenging. And so, you know, it's not to say all of it smoothed out and figured out. So what is giving you hope in terms of how a cash plus model can scale or can impact not only one life but many lives, right? And I'll open that to whoever wants to answer that.
I feel like I have a pretty good example of this. So my dad is also on the streets. He's been on the streets for a couple decades now. And I know that because of like directly related to the cash program, basic income, I've been able to help him in moments of crises, like meet his needs as well. And that I guarantee takes stress off of the system, like wherever he's at. Because if he goes into crises, like that affects the community as well. And so it's like a preventative measure. And not only that, but I'm also a believer in the kindness that we do, like it ripples out in ways that we can't see. Um, yeah.
Yeah. Um, yes. Yeah, and I see that just uplifted in the chat as well. Bonnie sharing that, monetary support also just like gives the opportunity to feel quote unquote normal, and Nellie, I think like you've been hearing so many stories through the digital diaries, just through participant feedback as well. What's giving you hope?
Yeah, you know, honestly, talking to Astara and Sarah gives me so much hope because it's, being transparent, it's hard. It's so hard. Um, it feels like things are changing every single day, and working in this space, you, we know we know we are only witnessing an ounce of the struggle. And if even that ounce holds that much weight, it's like that those things can be really heavy. And so it gives me hope to know that we are not the only organization doing things like this, right? Like we are not the only people doing work like this, caring for people in this way, seeing human beings as human beings. Um, and taking a moment to think about like we are four people on this screen right now with many amazing supporters, even just like lending us an ear and listening in. But all of the people that it's taken for us to get to that point, whether it's funders, volunteers, participants, people who are willing to do the evaluations, like everything, I think when we take a step back and look at all the people involved to get us even just to host this webinar today, that fact gives me hope. And although we've been through a few different iterations now, I really believe that like us as an organization too have such a bright future in this space. And so even just dreaming of what's possible is really like fills my tank.
Yeah, I appreciate that so much, Nellie. And I don't know if you want to just take a second to just even like shout out the organizations that are part of the Thriving Community Fund. Again, like we cannot do this work unless we do it together. All right. And we also have some of the organizations that do some of the cash transfers with us on our website, and we can drop that into the chat as well. And then Sarah, what's giving you hope right now? You are collaborating with other organizations, other than ourselves. You're seeing what's happening kind of nationally, internationally as well, but certainly nationally. Different populations that cash transfers are going to, whether it's people experiencing homelessness, and within that, there's like, different age groups, different backgrounds, and certainly in sort of like more working with youth, there's so much that you're seeing. What is giving you hope?
Yeah, I think a couple things. One is just I mentioned earlier community. I think we we live in a society where we have to work to live. And I think there are folks who are really struggling. And I think just locally, but also in nationally and several of the communities I've worked in or am working in have really seen a lot of folks in the community that um, through a simple invitation, thinking before like that, maybe that they don't want to be involved or they've said no before, but as invitation or a re-invitation to be part of something to support a lifting of all, I think has been really powerful and given me a lot of hope. I think the other thing too that has given me a lot of hope is particularly with folks who are receiving cash transfers, is this desire to invest in the next generation. This deep recognition that they want something different for their own children. And that's giving me a lot of hope too, that there's they see a future different than one that they have held in the past, not just for themselves, but for the folks that they're raising and that are part of their circle. And that's really truly inspiring because the next generation will also be continuing to lead this work, and that's really powerful.
Thank you all for sharing. I just like selfishly, I need to ask this question oftentimes in my days of like, what's giving you hope right now, right? And that doesn't take away the hardship or the challenge, right? But it just lets us kind of sit in strength together, right? And seeing some of these like glimmers of what is possible, and that there are so many people coming together around this work to make impact. So with that, I'm going to actually transition us to audience Q&A. I see some great comments, questions starting to emerge in the chat. And so let's kick off with a question I see from Mary. So with all the research that has been completed, I forgot the number, but there's a big number around, research articles, newspaper, just there's a lot that's been published about basic income. There's still concerns, right? We saw that in those headlines, and there's a lot of questions being asked. And questions are not a bad thing. Questions are a good thing, right? But there's concerns. And so what additional proof points are needed to minimize that gap of, I would say, not so much the curious learning questions, but just the sort of like throw it all out skeptical questions, right? And so I don't know, maybe Sarah, you can draw from some of your research and policy background. What are the proof points that you think are needed to kind of come onto the table for people to kind of believe? I don't know if you could ever get anyone to believe anything, but just believe that there is this growing body of evidence.
Yeah, I mean, I think so when I think about like cash transfers nationally, or when I think like this has actually been done in ways that we are just not calling it basic income. So when we think about the extended child tax credit that took place at the end of 2021, we saw huge reductions in childhood poverty. So, and this went across the board, and still there were lots of families that were left out. So I think like there's deep evidence around that. We also can all look to the stimulus checks that households received. So folks have been receiving cash transfers. And so I think I think there's always going to be skeptics. There's always going to be a question of, well, does this really work? I think for me, in the work that we're doing, I still think there are deep questions around um, for whom, when, and for what duration. And again, you asking those questions though, as it sits alongside other supports and other pieces of the current safety net, or what we could imagine the safety net to be. So, I think those questions are still important. And I think we'll continue to be asking those questions, particularly when we think about persons experiencing homelessness and how it interacts with existing housing supports and other services. So, I think I always, whenever I'm in conversation with folks who are skeptical, I try and bring in examples that exist more universally across, and talk about those as examples of where we have seen the evidence of how this works, and also invite them to let us know, like, what questions do you still have around this? Because I think even folks who are the skeptics can help us also inform how we think about new research questions.
Yeah, I love that. One of the things I'm seeing in the chat is kind of in relationship to this question, is sort of like part of it is getting these stories out there, right? And just that narrative change work of putting a face to the impact, right? There's, and it's going to be both. It's going to be the statistics as well as the stories. And so, yeah, just wanted to kind of name that in the chat. And then also, yeah, like there's so much to learn around how this intersects with, different experiences, even of homelessness, whether that's like older adult population, disability, like so many other intersectional components. So yeah, I don't know if Astara, you or Nellie want to kind of add to that or layer on to that.
Yeah, I was actually just thinking about how within my own journey, right, of experiencing homelessness and then healing from it, which is just my personal story, but I know that I've been housed for 2 years now, and I'm still things are just now starting to click into place for me. I'm starting to get into a routine and function like I assumed like an adult would. Like I always wished that I could. And so I think that there might be this trap of kind of trying to find immediate results when really like the long lasting, like deepest impacts, they take a while to see. And so I don't know how you would go about highlighting those things aside from just giving it time and, keeping up with the people who are benefiting. But yeah, I think that that might be something that helps.
Yeah, I think that's really powerful. And Nellie, I wonder if, I mean, this in my mind, this is where organizations, community-based organizations, nonprofits that stay in the community are in the community before, during, and after a study, right? Because the point is not for a study like there to be like, I don't know, infinite number of years for every study, right? Like that's just not feasible or possible. You can have different follow-ups, and that's definitely where a lot of our amazing collaborators and research come from with their lens. And it's the community-based organizations that are there, right? Like that's our job to just be there, stay there, and keep staying there. And so, Nellie, I wonder if you can provide perspective on just like, okay, how do we close these knowledge gaps? How do we learn more just on that like bread and butter program learning lens?
Yeah, it's so funny because it feels very like timely, especially for this week. Sheena, I'll give everybody kind of like a peek behind the curtain, but even this week, us and our researchers were like reaching out to our Thriving Community Funds partners, saying like, "Hey, let's talk data, let's talk data sharing." Um, and so for us, it's just such like a real-time conversation. But there's a lot of layers to it, but there's so much opportunity for us to say, how are people doing after this money? Even if it's just, hey, do they come back to your services in a few years? Of course, we want to do and gather as much as we possibly can, but we are a tiny team, a tiny organization, and in order to give dollars out, there has to be, equal, not even equal, but like proper delegation for certain areas. And that's where partnerships are just going to be so vital for people to care and work towards this together. And for us to leverage almost the requirements that other people are sharing and how can we learn from that and better our work, see where people are going long term, and make sure we're doing it right.
Yeah. Yeah, it's just like making me think of, how to make sure that people's voices are heard, right? And that goes into not just like participating in, that's important for sure, right? Participating in focus groups or surveys or things like that, but really being in a position of interpreting those stories and then like guiding that into program design and refinement. So, yeah, there's definitely a lot still emerging and figuring out the measures and, yeah, if there was a recipe and a way to do it
Hmm.
from before, everyone would just follow the recipe and do it, right? Like I think there's a lot even in the measurement space to test and iterate, figure out. Yeah,
Well,
right.
and I think too that like today, obviously, the focus is on belonging, but so much of that feedback that we hear from people impacts the systems we use, our distribution methods, like about the tactical experience of removing barriers to use and access the cash that we are giving with no strings attached. So I want to definitely like highlight that as well. Like when we talk about program improvements, a lot of that is just like people's experience in receiving and using the money. And things like the digital diaries, those are so important for us because when we see those emerging themes come out from participants, it allows us to make sure that's being captured in the measurements. To say, hey, this is what people are claiming is important. We need to document that journey better for them, and we need to represent the impact in a different way.
I'm curious. Okay, so I don't know if this is like a little bit of a curveball question, but we're here for all the different kinds of questions. So, has there been anything, in all the different ways that you have encountered basic income and social supports, accompaniment, all of these things that has surprised you? Like, what was like, oh, I didn't, and it could be surprise good, surprise hard, but just like, what surprised you in doing this work?
I can kick it off. I don't want to take time up from anybody else, but I mean, so many things. But one thing that it almost like surprised me initially, but then the moment you think about it, you go, oh, that makes sense, is the initial distrust that might happen. What do you mean you want to give me this amount of money for a year without asking me for anything in return? That is very like, you know, but what's in the fine print is the question. And you might think, oh no, but like there is no fine print. But the moment you think about it, you go, of course there's distrust in systems. It's such a big part of people's stories. So that's one piece of it. And then the immense generosity of people who are getting the monthly incomes continues to just overwhelm me with like gratitude and also regrounds me. And like, of course, you hear Astara talk about like how you believe in the kindness. And it's what we see over and over again, where it's like, I bought soup for my neighbor because they were sick. And I'm like, do you have dinner tonight? And it's not my question to ask. Like people are adults, they meet their needs, but you see this theme of like next week is unknown, but today my neighbor is sick. And so it's like this really deep ties to community.
Yeah, I think I'm surprised not only like through my own growth that I've, noticed from the assistance, but also knowing other people who have benefited from the Miracle Money program and seeing the ways that they have utilized that within their own life and just continue to blossom. That for me is really solidified like, oh, it's not just a me thing, right? Like this is helping like I mean, I haven't met anybody who hasn't like truly had deep growth from, from the help. And so it's just, it never fails to kind of knock me back and make me think and ponder life and stuff.
Sarah, what about you? Anything that's like surprised you over the course of years and overseeing lots of different cash transfers?
Yeah, I mean, this is like I'm sort of nerding out on the policy piece of this, but I think one of the things that has surprised me, even as of recent, is just the willingness and desire for state and local governments to come to the table and say yes to cash. I think there's these really deeply ground in systems that we in the nonprofit space we like operate in and navigate. And I think um, there are willing champions in government spaces that want to come to the table and think creatively about this. I think we're even starting to see ways in which cash transfers are designed, this no strings attached approach really starting to carry over into other programs, or at least to begin thinking about it. And that's really powerful. I don't know that 10 years ago, without the movement of a lot of these pilots, that folks would be really start at the government level. So it's still like I get very excited when someone from the public sector is like, yes, we want to do cash, or learn more about how we can integrate these design measures. And it's still, I'm like, okay, this is great. Folks, like the willingness is there. So
Love it. More of it, more just sort of like willingness to explore and to co-design together, right? With community-based agencies that have been in it for a while or seeing the need on the ground, and most of all for people like Astara, Bonnie, people who have that lived experience expertise to guide us. I have I see a question in the chat that would be really great for all of you to share. This is from Holly. What narrative change work do you think is necessary, and how can all of us participate in that narrative change? And I'm just to make it less awkward, I'm gonna like pass around a virtual mic. So, Nellie, I wonder if you could kick us off because I know you have many thoughts on
Yeah.
this.
It's funny. I was gonna go first, and then I was like, I'm going first too much. I'll wait. Um, but yeah, there's a lot of amazing narrative change work being done, and I think that there's always more to do, and both of those things can be true at the same time. I know I saw Erica on the call earlier from Income Movement. Income Movement, I don't want to speak too much on their behalf, but they're forming things like a pilot participants union, where it's really saying, hey, pilot participants, people who have experience receiving basic income, here's the space. Where should we go? I'm obviously oversimplifying it, but we see these really amazing pieces pop up. I also think income movement is one of the pillars of really like pushing narrative change. But for us, I mean, being here today, for people that maybe weren't familiar with miracle messages before today, this is our first webinar, and really exciting that we're even in this space now. And we want to do things like this that are more almost educational based, but we are constantly working on how to focus voices of people in our programs. And I feel the irony when I say that sentence as somebody on the program side speaking that. But if you stay along and watch our journey, you'll see that theme reoccurring.
Yeah, narrative change. So Astara, I'm gonna kick it to you. Like what do you think um people maybe are getting right and we want to amplify that, and also maybe where people need some guidance to learn like a different narrative around this work.
Yeah, I mean, I think it's a beautiful thing to see people say like, hey, there are groups of people who are vulnerable and who need assistance, and people who have the capacity to help them are like wanting to do that. I think that that's wonderful. And I also think that sometimes it can be a bit misguided, even if it's well intentioned. So I think, as far as like changing the narrative, something that might help, um, and it's a tricky, sticky situation. I very much believe in the power of self-transformation, like getting to know and take inventory of what's happening within yourself on like a subconscious level is so important. And it also frees up space, um, to allow others to live their own life, right? Without placing any kind of judgment or bias on it. I'm a big fan of like the unconscious integration of aspects of self. So I mean that takes a bunch of different individuals choosing to do that, which is why it's like. But I do think it would help a lot. People really got to know themselves and how they viewed the world, and it would give them a more accurate and efficient way of moving through the world, compassionate to others' life stories.
Yeah. Sarah, what can people do to participate in like the narrative change component of this?
yeah, I mean, I think I mean, I know, so we've been talking about individuals experiencing homelessness, families experiencing homelessness. Um, Mighty Soul over at the Housing Narrative Lab, I think, has done a really good job in talking about housing. I think we are at a moment right now in time where there still needs to be a lot of deep narrative change around homelessness in particular, and the complexity of it. It constantly just feels like the pendulum is swinging from extreme to one side to the other. Um, and and I think there's an opportunity, as Tara mentioned, I think, folks through their lived experience coming forward, informing policy, informing programs, and being a central part of that, not a side, but a central part of that narrative change work. Housing is something it's a basic right. Every one of us desires to lay our head to rest at night in a safe place. Um, and um, and so because of that, I really do believe that that really is where we need to start thinking about this. And shouldn't just stop at housing. It's the all the whole pieces that we've been talking about that make someone whole. And not forcing someone into a place that we think is good for them, but allowing them to choose a place where they feel safe, is so important. So I think that narrative work, I know has been ongoing, and there's still so much work to be done. I think to really shine a light on the truths and not what we think to be the stories.
Yeah, thank you for that. And thank you to everybody in the chat. It's moving quickly, but just even from what I'm seeing, Kim, thank you for sharing your experiences and also just like your desire to put what needs to be talked about out there through op-eds, and through, sharing that insight as well. I see something from Sarah that is asking a question to anyone who wants to answer on the panel. What has been the most frustrating limitation in the programs that you've seen around this work? And have there been any discoveries in how to navigate those barriers or frustrations moving forward? And I think each of you could answer that in a different way, right? That's by design, the panel has different perspectives. So feel free to jump in. Let's switch up the order just because, yeah, we'll do it in reverse. Sarah, do you want to just start out again and we'll kind of go back around?
Sure. And again, I'll sort of provide the high level. So I think one of the most frustrating limitations with direct cash transfer programs more generally across is that folks who are on SSI, it will automatically kick them off. There were movements at some point to really try and find a workaround with this at the federal level. And so what this means is that a lot of folks with disability, there are programmatic ways to go about ensuring that they could receive cash transfers without losing that benefit. But there have not been sort of policy level ways to do that. And I think that limitation is really frustrating because then we're leaving out really important parts of the population that could truly likely benefit from cash. So I think that that's been a challenging one. And again, finding ways to navigate it at the programmatic level. For those who are interested, every state has ABLE accounts through their state treasuries, and there are programmatic ways to set that up.
How about you, Astara? Any frustrating limitations and how, I don't know, how have there been any discoveries in how to navigate those frustrations?
Yeah, I mean, I definitely agree that the benefits was something that was tricky to navigate. But uh where there's a will, there's a way. It's also the same for general assistance as well. And for people who are in the shelter, you have to be on general assistance in order to have a bed in the shelter, which not a lot of people know about that. I didn't know until I was in one. Um, but then also I kind of struggled with I was how it's like, I mean, it still is a good amount of money, but how it was broken up, there were times where I was like, oh, I could get a car with the total amount of money that I could get, but it's broken up. And we had kind of discussed that within the MAC, saying like maybe there should be some kind of, you know, option to apply for a larger portion if like an emergency situation arises or something like that. Which I think that a lot of that comes just from the experience and feeling out the program as it continues to develop.
Yeah, Nellie, I wonder, I mean, just the general question around frustrations and how to navigate it, but certainly around this piece around like there's times that you've seen with participants where what Astara was sharing, where like the lump sum makes sense, and then there's other times where having the um it's more the continuity, right? And the consistency of monthly payments across a year is powerful. So yeah, I don't know. There's pros and cons to everything, but I'm curious what were maybe one or two frustrations you've seen and discoveries around them.
Yeah, I mean, I knew mine and Sarah's were going to align really around, um, the benefits. The benefits piece is a really tricky piece to juggle and to manage and also to advise people on because it's not our field of expertise. And so we, that piece is really hard. And as I mentioned, one of our current distributions is focused in California, but our other distributions, we are a nationwide organization. Although we have such a strong footprint in California, we have people in our Miracle Friends program from all over the US. And so that Dignity Fund program, you are not only looking at federal benefits, but also if a person is in a state with certain state limitations. And states are, certain ones are putting more barriers to programs like this. And so that can feel incredibly frustrating, especially when it feels like we are working with such basic human needs. To feel these really significant barriers can be difficult. Um, During our development into this phase two, we really look at different program designs, and if there's certain program designs that have almost like cracked the nut on basic income intersecting with homelessness. And so dollar amounts, forms of distribution, the cadency of the money is all things that we look at, and it's all things that we look at as we enter different iterations. So as I mentioned earlier too, like those programmatic learnings, the way that the money is received is also one of those things that we look at.
Okay, I think we have time for one more question and then we'll move, don't leave yet. We will move to just a quick evaluation because we want to hear your feedback. We want to make sure that any future webinars, incorporate your feedback or if there were questions that weren't addressed and, we'll be sure to loop back with you through other channels. But as we close out, I'd love for each of you to think about this final question. Can you all speak to how Miracle Messages centers humanity and relational connections in this work, as well as the financial component? So we're kind of coming full circle to basic income and belonging, right? Not one more than the other, but at the same time of addressing essential needs and just relationship and connection. So here's the question. How and what would it look like for other service providers to follow that approach to address essential needs and um, social supports? Okay, I'm just going to go reverse again. Nellie, you're going to start, and then we'll go Astara and Sarah, and then we'll close out that way.
Okay, beautiful. Um, we do it with our basic incomes. Everybody's who receiving cash has a person, right? Like whether that is a person through a partner or a person through our Miracle Friends program, but everybody has a person. I can't speak broadly on how other organizations could or should structure that, but sometimes it's really as simple as that. And a lot of these people that they have, it's not always goal oriented. Sometimes it is, and sometimes that's what people are looking for, but especially with our Miracle Friends, it is quite literally a person to see you and to hear you and you do the same. I hear from our Miracle friends on like the recipient side how quickly and how often they are the listening ear, right? It's like it's the same relationship analogy where it's like no relationship is 50-50. It'll be like 60-40, and then it switches. We see the same thing with our Miracle friends and their relationships. And so um, I think it's so vital to provide a person to just walk the journey alongside them and not guide them down, this is what you should do with the money. And I think that's almost like the secret sauce that we work with. And I would just encourage other orgs to look how that can be built in.
Yeah. I'm curious how that lands or resonates for you, Astara.
Yeah, I mean, I definitely think that a big component of it is allowing people to figure out who they are and to be seen. Um, to really feel like they have a choice because oftentimes the whole experience of, becoming unhoused and then having to go through the system, it really leaves people, well, I mean, I know it left me and the people that I know feeling empty, like former shells of themselves. And so there is a really big impact of just giving people that space and that room to breathe and to through the midst of whatever they're going through really give them the chance to learn, who am I, what would I do. I really do believe that people are good at heart and that when they're given the opportunity and the circumstances that they want to help other people, especially when they have experienced the level of pain that is associated with becoming unhoused because they know what that's like. And yeah, those are typically what I've noticed the fiercest advocates are. So they deserve our support and our love and to be respected as people.
I just feel like every time you speak, Astara, I'm like, yes. She's like, no words, yes. And Sarah, I'm just going to close out with you before we head into our final kind of evaluation poll and a couple of just closing items. But Sarah, what would you recommend to service providers? And I kind of come back to your accompaniment piece earlier and just like the the need for having that alongside the Cash Plus model.
Yeah, I mean, very difficult to follow a star. I feel like a star should have just ended us. I think just again going back to this deep recognition that we're all human. And we all hold um different, challenges and different failings. And I think the grace, giving one another the grace to know that sometimes there's going to be missteps and recognizing like there are these systems that are super rigid and tell us to stay in the lanes, and oftentimes folks that are coming in, the courage it takes to ask for help, the courage to say, please see me for who I am. That is what I think a lot of providers hold, and just to continue to hold that when working with folks, that deep compassion of, again, you matter.
Those are great words to kind of end our time with. And so thank you again to each of the panelists for sharing your insights on the call today. And so we're going to launch a quick evaluation poll, and we'd love to hear what the webinar was like for you, and anything you would want to see in any future webinars, whether it's basic income or other things. We also have, as I mentioned, some materials coming out. We already have a couple things published that you can check out on our website. The easiest thing would be just to get connected with us on our newsletter if you aren't already, and that allows you to see what's coming out in terms of the RCT report, the issue brief series that's coming out, findings from Thriving Community Fund and Dignity Fund as they are finalized later on in the year or in the beginning of next year, and all of the great work that the MAC and Advisory Council are doing as well. So links in the chat. Feel free to finish out the evaluation. I know everyone has to run and you have very busy days. So just super grateful for your time today. Yeah, and as you mentioned, as I mentioned, there's lots of ways to get connected. So there's some QR codes, some links in the chat. Thank you all and have a good rest of your day.